Now coming to the deep cervical fascia. Deep cervical fascia, also known as fascia coli. The area which is devoid of deep fascia is number one is the face, but exception is there except the parotid region. Parotid region. Why it is absent in the face? Because the facial expression should be seen. The facial expression should be there, so it is absent. Number two is in the anterior abdominal wall. Anterior abdominal wall. So because the abdomen has to, it need to expand. It need to expand. So the deep fascia is absent here. Now coming to the modifications of deep cervical fascia. Deep cervical fascia modifications. Number one is investing layer. Number two is pretracheal layer. Number three is vertebral layer. Number four is carotid sheath. So remember these three. That is the investing layer, pretracheal, prevertebral layer. All three together will form the carotid sheath. Now coming to the buccopharyngeal fascia is lined outside. Remember buccopharyngeal fascia is outside, and the pharyngobasilar fascia is lined inside. It is lined inside. Now coming to the transverse section of the neck. This is the anterior side, and this is the posterior side. And the muzzle is investing layer covering the two muscles, one muscle in the posterior and one muscle in the anterior side. And this is the vertebra which is present. This is the carotid sheath, and this is the trachea. And this is the esophagus. Anteriorly, it is the thyroid gland covered by what? Covered by pretracheal fascia. These three, that is the pretracheal, prevertebral, and investing layer, will lead to carotid sheath. Coming to the labeling, remember this is the anteriorly sternocleidomastoid muscle. This is covered by, this two is covered by investing layer, and this muscle is the trapezius muscle. This is the trapezius muscle, and this is the carotid sheath, and this is the prevertebral fascia, and this will lead to the formation of axillary sheath. It is an extension of prevertebral fascia, is the axillary sheath, and it also covers the brachial plexus. Okay, and this fascia which is there, this outside fascia, which is covering the thyroid gland, is the pretracheal fascia. It has two layers, that is the visceral layer and the muscular layer. Muscular layer covers the strap muscles, and the visceral layer will cover the thyroid gland. It covers what? It covers the thyroid gland. And remember, the pretracheal fascia, which is here, is covering the thyroid. This covering is the false capsule. So remember the difference between the true capsule and the false capsule. What is the true capsule and the false capsule? True capsule is condensation of what? It is a condensation of stroma, gland's own stroma. So this is the gland's own stroma. False capsule comes from the outside. It is the false capsule is coming from outside. So it is the outside stroma or the fascia. This is the outside fascia, that is like pretracheal fascia. In case of thyroid, it is the pretracheal fascia, and in case of prostate, it comes from the pelvic fascia. In case of prostate, it comes from the pelvic fascia. Now coming to the axillary sheath. Remember the axillary sheath is a modification of what? It is a modification of prevertebral fascia. It is a modification of prevertebral fascia, and it encloses what? It encloses axillary vessels and nerve. Now coming to the carotid sheath. So in the carotid sheath, which you have to remember is the artery is the common carotid artery. This is the internal carotid artery, and it gives a branch here. This is called as external carotid artery, and the nerve here is the internal jugular vein, and the nerve which is present here is the vagus, and the nerve which is present here is the vagus nerve. Okay, this internal jugular vein, it comes from vasculogenesis. And the common internal carotid artery also comes from vasculogenesis, and this external carotid artery comes from angiogenesis. It comes from the angiogenesis. What do you mean by angiogenesis? Blood vessels coming from the which come from the another blood vessel. The blood vessels coming from another blood vessel is called as angiogenesis by what? By budding or by splitting. Okay, by budding or the splitting. While has the vasculogenesis is nothing but it is developed from the blood vessel is developing from where? It is developing from pre-existing. It is developing from the pre-existing mesoderm. Now remember The common carotid artery gives rise to internal carotid artery. Internal carotid artery gives rise to medial cerebral artery. Via this is called as vasculogenesis, and this is also via vasculogenesis. Hence, hence remember, this is the thrombus will most commonly goes to the most commonly. Hence the thrombus is more common in medial cerebral artery. Now coming to the next is, remember this diagrammatically, that is the internal carotid, the carotid sheath. Remember the carotid sheath anteriorly related to ansa cervicalis. It is adherent to ansa cervicalis. Ansa cervicalis. It is related to ansa. Posteriorly it is related to sympathetic chain. It is related to sympathetic chain, and there will be one artery here, internal carotid artery. This vein is called as internal jugular vein. And the nerve is a vagus nerve, and the nerve is a vagus nerve. Now coming to the vagus nerve. Now coming to the next diagram. Remember, if this is a prevertebral fascia, this is a prevertebral fascia. If this is a prevertebral fascia, this is the vertebra. This is the vertebra. This is the vertebra, and this is the vertebra. This is the, remember, this is the scalenus anterior. This is scalenus medius and scalenus posterior. Scalenus anterior, scalenus medius, and scalenus posterior. Remember, this is the carotid artery, carotid fascia, which contains the 10th cranial nerve. This is ansa cervicalis. This is the sympathetic. This is the ansa cervicalis. This is the sympathetic chain. Sympathetic chain. This is the sympathetic chain. This is ansa cervicalis. Remember, this is the prevertebral fascia. Remember, the sympathetic chain is present anteriorly in front of the prevertebral fascia, while has the phrenic nerve is present behind the prevertebral fascia. This is the phrenic nerve. And here is the brachial. This is the brachial plexus. And here it is the esophagus, and in the front it is the trachea. And in the tracheoesophageal groove, tracheoesophageal groove, there is a nerve called as recurrent laryngeal nerve. In the tracheoesophageal groove, it is a recurrent laryngeal nerve. Now remember, in the neck, remember, vagus is in front, while has the phrenic nerve is present in the back. In thorax, remember, the vagus is back, and phrenic nerve comes front. Phrenic will be in the front. Now coming to the next is the sagittal section of sagittal section. Remember the sagittal section. If you turn the face to one side, this is the mandible. And the investing layer splits to accommodate what? It splits to accommodate submandibular gland. This is the submandibular gland. This is the investing layer. This is the hyoid bone, and in the front again the investing layer is continuing. This is the investing layer. So it starts from zygomatic arch. Include the parotid gland also. So this investing layer will form the burn space above the manubrium sternum. It forms the burn space above the. This is called as suprasternal space, also called as BURNS, burns space. That is the burn space. This is the manubrium sternum. This is the manubrium sternum, and here's the this is the pretracheal fascia. This is the pretracheal fascia, which include the thyroid gland. And remember, it ends at T4 level. This is the fibrous pericardium. This is the fibrous pericardium, and the ends here at the T4 level. Now coming to the posterior view of sagittal section. Posterior view of the sagittal section. Here, this is the base of the skull. This is the base of skull. And this is the vertebra, and this is the vertebra. 1, 2, 3, 4, 5, 6. 1, 2, 3. T1, T2, and T3. This is the pretracheal fascia, and the space is prevertebral. This is the prevertebral. This is the prevertebral fascia, and the space here is the prevertebral space. This is the prevertebral space, and in the front, remember this region. This is the pharynx. This is the pharynx. And from the pretracheal fascia, there is a splitting of pretracheal fascia, which is called as anterior. This is called as alar fascia. Remember, this is the anterior layer. Of prevertebral fascia. Remember, it merges with buccopharyngeal fascia between C6 to T4 level. This is called as alar fascia. Okay, this is the buccopharyngeal fascia. This R space is called as Retropharyngeal. This is called as what? This space is called as retropharyngeal space. This space is called as retropharyngeal space. And remember the prevertebral space. The prevertebral space. This is the prevertebral space. This space is called as prevertebral space. Separate from the thoracic region by extending a fascia. This is separate from the thoracic region by extending the ligament. This is called as anterior longitudinal ligament. So remember, any infection in the prevertebral fascia, prevertebral space, in the prevertebral space does not go into the thorax. It does not go into the thorax. It does not go into the thorax because of the anterior longitudinal ligament. While has this D space, any infection in that D, that is called as danger. D is the danger space. It is the danger space. So any infection in this region can go in down, can drop down. It drops, the infection can drops down to posterior mediastinum. It drops down to posterior mediastinum. It drops down to posterior mediastinum. It causes dysphagia and dyspnea. Dysphagia and dyspnea. The posterior mediastinum start from T4 level, where this retropharyngeal space will end. Okay, so the retropharyngeal space will end. Remember, the anterior most will be the what? Which fascia? It is the investing layer. It is the investing layer, and posteriorly back it is lined by, from the outside it is lined by buccopharyngeal fascia, and this is the prevertebral fascia. The anterior part of the anterior layer of the prevertebral fascia will form anterior is called as alar fascia. This is alar fascia. This leads to the formation of retropharyngeal space, and the space behind the prevertebral fascia is prevertebral space. It is a prevertebral space. Okay. Now coming to the next is the investing layer. Now coming to the investing layer. Remember, it has two spaces. If this is the clavicle, this is the clavicle. This is the manubrium. This is the manubrium sternum. The space here is called as suprasternal space, which is also called as burn space. Okay, this is the burn space, and the supraclavicular. This is called as supraclavicular space. Now coming to the suprasternal or a supraclavicular space, what are the content of this space? This space has interclavicular ligament, the ligament between these two, interclavicular ligament. Number 2 is jugular venous arch. There is a two anterior jugular vein on the left side and anterior jugular vein on the left and the right, which forms an arch in the burn space. Number 3 is the sternal head of sternocleidomastoid muscle. And now coming to the supraclavicular space. In the supraclavicular space, remember, if this is a supraclavicular space, it contains a vein, and a nerve into three parts. It has nerve into three parts. Vein is external jugular vein, and the supraclavicular nerve. It is having the anterior part of supraclavicular nerve, medial, sorry, not anterior. This is the medial part of the supraclavicular, intermediate part of supraclavicular, and the lateral part of supraclavicular nerve. The one thing which you have to know is C5. That is the T5 diaphragmatic. The diaphragmatic pain are referred. The diaphragmatic pain are referred to the shoulder tip. The diaphragmatic pain are referred to the shoulder tip due to C5 connection of lateral supraclavicular nerve. C5, due to C5 connection of lateral supraclavicular nerve. Now coming to the rule of 2, it follows the rule of 2. That is, number 1 is it encloses two muscle, that is sternocleidomastoid and trapezius muscle, and two glands. It encloses two glands, that is submandibular gland and sublingual gland, and it encloses two space, that is suprasternal and supraclavicular space, and it encloses two ligaments. That is, number 1 is stylomandibular ligament, and number 2 is splenomandibular ligament, stylomandibular and splenomandibular ligament. Number 5 is two pulleys are there. Number 1 is digastric muscle, and number 2 is homohyoid muscle.